And Peter, I
Okay,
just want to
everybody.
say that you can put it on gallery view to see all the students.
Well, okay. Well, welcome everybody to another episode of Mondays with Moshe. This is Moshe Norman out in Lakewood, New Jersey tonight with the very renowned and very humble Dr. Peter Levine out in or around or near San Diego, California. Peter, you're lucky because it's only 6 p.m. by you, although it's dark, but many of us are rubbing our eyes and yawning. And you have the opportunity tonight to keep us awake and with toothpicks holding open some of our eyes. Hopefully, we're going to have the fortune of hearing some words of wisdom, pearls of wisdom from Dr. Peter Levine, innovator of Somatic Experiencing, author of, I believe it's 8 books by now, and especially Waking the Tiger, I think, for which you're most known. And a book that is coming out in just a couple of months, I believe in April, called An Autobiography of Trauma. And perhaps we'll have the opportunity to discuss some of the content of that book tonight. Dr. Levine, thank you very, very much for giving of your time to present to the mental health community, to share with us and to share your knowledge and creation and innovation of somatic experiencing. Tonight's topic is the process of somatic experiencing in psychotherapy. Thank you.
Yeah. Well, when I started developing my work in the late 60s into the 70s, I was, I guess, fortunate enough that I didn't know that trauma was an incurable brain disorder or brain disease that could only be managed by helping people change their thoughts or by medications. And what I discovered was that, yeah, of course, trauma is something that happens in the brain, that happens in the mind, but it's also something, maybe even primarily something that happens in the body. So we see something that's really frightening, or let's just say you walk out the door tomorrow morning and you see somebody's been hit by a car and your guts twist. And that twisting can stay with you. We're afraid of being hit, so we brace against being hit. And again, these are the things that the body does to protect itself, but it gets stuck there. It doesn't put an end to it. It keeps replaying it as though it were happening in the present, even though it's coming from the past. So when I found that I could help people change these imprints from their bodies, then many and maybe even most of the traumatic symptoms would disappear. And so that really, the name of the approach that I developed, I call Somatic Experiencing, which really means the experience, the bodily experience, the living bodily experience that is something that we can shift, that we can change, that we don't have to be stuck with it. Somebody asked me, well, what words do I have of wisdom about trauma? And I say, well, how about this? Trauma, bad news. The trauma is a fact of life. The good news is it doesn't have to be a life sentence. And I think the importance, again, about working with the body to be able to complete what the body was doing to defend itself. So again, if I'm bracing about being hit and my shoulders are up like this, well, then if that happens enough, the shoulders stay up there. And it keeps signaling to the brain, to the mind, that there's threat, that there's danger. And so when I become aware of that, aware of how it's held in the body, I can begin to just release that tension, and that releases the feedback loop that is being put in place by the trauma. So it's a different approach to trauma. It's not about erasing trauma. It's not about trying to changing our thoughts about trauma, even though medication can sometimes be helpful. truly, I'm not against medications, but if that's all you have, I think it's pretty limited in what can be done. So, but if we are able to change and complete, so if our shoulders are going like this, then if we can very, very gently touch into it just a little bit, just the smallest amount, and then let it go and release it, then waiting, just noticing what happens. And again, just touching into the sensation, feeling the shoulders lift just the smallest amount, and then releasing. So again, it really is about discovering what the body was doing to protect itself, how that got stuck, and how we can complete that which was incomplete.
Excellent.
So in a way, it's very simple, but it also really takes a different shift, a different paradigm from the normal approaches or the common approaches for healing trauma, or treating trauma.
Okay. So wow, that was a synopsis with packed with a lot of information
Right.
and detail. So I'd love to break some of that information down. I have a lot of questions about somatic experiencing and about some general questions about treating trauma. So if you can bear with me, I'd like to just ask a question about window of tolerance and things like that. In somatic, it's in the classical or older psychoanalytic or psychodynamic work, my understanding is that therapists were very comfortable allowing the client to experience whatever experience they were having, being very present with them, holding them through those experiences. And in many, I know in certainly in the beginning of my career, which was not that long ago, about a dozen or so years ago, I was comfortable, or I got comfortable allowing clients to sit through their traumas as they repeated them and relived them. Yeah. And what I started to learn over time is that sometimes those experiences were, I'm going to use the word, too intense for them.
Yeah.
And I'm curious, in somatic experiencing, do we allow clients to just go as deep and as painful as they need to go? Or is there a window of tolerance that we try to keep them in? Tell me some of what's on that.
Right. Yeah. I mean, there are some cases maybe where it's helpful, but reliving the traumas in terms of the nervous system, it's really not that different from being traumatized in the first place. So you can be reinforcing the trauma. So I definitely try whenever possible to work within that window of tolerance, to just touch into the sensations, not to go, hell-bent into them, but to touch them. The example I gave with the bracing with the shoulders, instead of going into this in a cathartic way, we touch into it just the smallest amount and then letting it release. Then letting things settle, and then again touching into it gently and then letting release. Okay. So it's
So you don't want the client or the patient to experience the trauma so intensely that they are either dissociating or reliving the trauma.
No, because again, I don't think reliving and dissociating is really helpful. I mean, there are times when the person just goes there and you just have to be present there and hold the space. That happens. But it's not what I look for. What I look for is really how to just touch into some of these sensations or images one small amount at a time, and then allowing the experience to settle and to integrate into the body and, of course, also into the mind. So it's a matter of touching into rather than crashing into.
So when you're using a somatic experiencing intervention, do you have the client, tell me a little bit about what that looks like. Do you actually have the client remember the story, the incident, or do you just focus on feelings, somatic experiences that they're having without necessarily attributing them or bringing them back to the incident?
Well, with certain preconditions, but yeah, what you're saying is correct. Rather than going into the trauma and but we may touch into certain aspects of the trauma, certain sensations, certain feelings, certain images, or certain images that might come up. And so you can work with them, but again, you want to work with them in a gentle way, and gentle as possible, so that they're not overwhelmed, that they're able to touch into what you called correctly the window of tolerance. So in other words, you have to be able to help them go into it enough for it to make a difference, but not too much to where they dissociate and shut down again.
Mhm.
So it's really a matter of what I call titration, just touching into the experience and moving into the experience, usually what has to do with the feeling of contraction, and then moving into an expansion. Wait a minute, I think, okay. So here, we'll take one of my toys here. So when a person first touches into the trauma experiences, they feel a contraction, and they are maybe will resist that contraction, and by resisting it, it persists. So the idea is that the therapist just gently has them move into the contraction, just the smallest amount, and then move into an expansion, and again into a contraction, and then again into a greater expansion, and again another contraction into a still greater expansion. So instead of going directly from contraction to full expansion, it's really shifting back and forth between the two, between contraction and expansion. And, again, for me, that's the essence of effective trauma therapy.
Okay. And is that done by having them remember snippets of incidents of the trauma, or like how do you invoke this information enough to be able to start working on their somatic experience?
Well, again, the idea is to titrate it, to just touch into it. So it's enough, but not too much. I mean, if there's not enough, then there's not the opportunity to what I call renegotiate. People talk about reliving a trauma.
Mhm.
I refer to it as renegotiating the trauma, and it's quite a different approach. So, again, you as a therapist, you want to be able to guide the client to touch into these sensations, these feelings, these thoughts or images that come up, and just begin to, I don't like to say welcome them, but to bring them into a safe awareness, a safe enough awareness. So, I mean, that's really the essence of how somatic experiencing works.
Okay.
Yeah.
I just want to remind the crowd, for those of you who are new to Mondays with Moshe, for those of you who are here and have questions, please click the reactions tab on the bottom right of the screen. If you have a question that you'd like to ask or a comment, click the reactions tab, raise your hand, and I'll call on you and we'll be able to take your question.
Oh, good idea. Good idea.
Yeah. So there's a number. There is a number of people who are asking, either chatting with me directly or to the crowd. I'm just taking a peek. Can you give a little bit more specifically what would a somatic experiencing session look like? I guess in terms of how you would touch on the experience that starts to bring out some of the somatic expression, and then where would you go from there?
Right. Well, the first thing, you generally want to have them become aware of their body sensations, because that's telling them what their body was doing to protect and defend itself.
Mhm.
You can't always do that, but that's the idea. You want to just touch into it. And so you may start in somatic experiencing. There are 5 channels of experience. There are sensations, there are images, there are behaviors, there are affects, feelings, and meanings. And the sensations, again, are directly what comes from in the body. So it's a combination of how our muscles are contracted, how the position of our joints is established. And these are things, again, that the body knows how to do. It knows how to do it very, very, very well.
Mhm.
And so I'll usually start with sensations. There could be visceral sensations, sensations that are going on in the belly. It could be contraction for trauma or tingling and vibration and warmth as people move through the trauma. So again, it's a matter of not reliving the trauma, but renegotiating, touching into these different sensations and feelings and images that might come up, and then also connecting to the different affects, which could involve emotions, but more generally to what I call felt sense, sensation-based feelings.
Mhm.
So for example, we can be angry, we can be sad, we can be joyful. These are all emotions. These are the emotions that were Darwin really discovered. But if you go out in the morning and you look at a blade of grass and you see droplets of dew on the grass and you're just touched by that, you're moved by that. Well, that's something that's a felt sense. I think when we have even spiritual experiences, religious experiences, they're not emotions per se, but they're things that we feel deeply within ourselves. And so that's really what I'm looking for when I work with a client, to see what's going on with them in the present as they come in. Of course, if they have something that's been troubling them, something that's going on in their life that's problematic, we may talk about that, but I try to gently shift the person's awareness from that to the body sensations, and body feelings.
We do have a question. Let's take a question and then we'll carry on. Ella, go ahead.
Thank you so much. I have two related, I think, questions. One, what would be the difference in treating someone with a very specific traumatic event and someone who's had what may be called more like complex trauma or early
Sure.
childhood attachment trauma, where they can't even necessarily identify any specific experience, but the whole like water they swam in was traumatic. And the second I think is well, the question is, do you feel that perhaps autoimmune diseases are a sort of an expression of those kind of traumas, because they're often found in people who've had. Thank you.
Yeah. I mean, usually it's a combination of both. There are specific events where, boom, we're just shocked out of our body. But then there are the eroding forces where there's been a failure to connect, to bond, to attach, to co-regulate with a caregiver. And those have to be worked through more slowly. But the basic principles are actually similar. But it's more complex. And again, because these injuries occurred in relationship, they also, at least to some degree, need to be reworked in the therapeutic relationship, of the client-therapist relationship. So again, I think it's mostly both. And autoimmune diseases are very common when there's a lot of early trauma. The ACE questionnaire, the ACE questionnaire that Felitti and Andrus developed. Well, people who there are 10 categories, and if you have a positive response, you have a trauma in 2 or 3 or more of these, you are much likely not only to experience anxiety, depression, trauma, but to different kind of physical and medical conditions. And again, this is not just medical, but they often are medical. So again, a higher rate of diabetes, a higher rate of other diseases that are associated with early trauma. So again, we have to be really careful, because we talked about before about the window of tolerance. The window of tolerance with people who have these kind of physical conditions like autoimmune conditions, that level is very much smaller. So you have to be very cautious and not push, certain not to overwhelm the person. Yeah.
Just a really quick follow-up. Dr. Levine, do you find that if the trauma has been treated over time, the autoimmune disease also gets treatment of sorts from that, from the trauma treatment?
Yeah, well, that's often the case. When I was seeing people, I don't see people anymore for sessions, but I would sometimes, I would work with them, and it could make a significant difference. But often I would have them work with another type of practitioner, a medical practitioner, or somebody who practices like Chinese medicine, acupuncture, homeopathy, and so forth. Those are also things that can be helpful and beneficial. Of course, to work with the imprints of the trauma on the body, on the immune system, either immune system that's too reactive or immune system that's not strong enough. Then these are the people who are they never seem to recover even from a cold. So that's where there's a weakness in immune system, where the body is attacking itself, like in lupus and autoimmune conditions like that. The body is overreacting. And so again, you have to very, very cautiously work with those reactions. Very, very carefully.
Peter, can you tell us a little bit about what the somatic experiencing session looks like, as far as how you use the somatic experience in session? We're bringing awareness to the different parts of the body, and then what?
Well, very often, if you ask a person who's had trauma what they're experiencing in their body, and they'll say nothing, which is how they experience things. And then I say something like, well, is that nothing? Does it feel like numbness or anything else? And often the person, yes, it feels numb. I said, okay, well, that's the sensation. That is a feeling. So let's just see what happens if we follow that numbness and see what might be underneath it, what might emerge when you're contacting that the numbness. What's underneath there? Tension, could be vibration, it could be many, many different things. But again, the idea is to just go there, but not to go there too quickly and too precipitously.
And then what? So now we're in the field.
Okay, so then now when the person contacts a sensation, sensations will almost always move forward on their own. Again, if there's not too much and if there's not enough. So you, again, really want to follow the person, to be with the person, to take their hand, to be their guide into touching into those sensations. Because when they do, those sensations will tend to move. They will tend to emerge. They'll tend to move into different feelings and different sensations. So it's really helping the person gain trust in their sensate body, in their living body. And, in somatic experiencing, basically that's what we do, is help the people move into these difficult sensations. But because they're not overwhelmed, they will tend to move through on their own and tend to resolve. And when they resolve, that's very frequently when the trauma begins to resolve, begins to heal and move through.
So I imagine that the safety in the relationship with the therapist plays a great role in how a person can allow themselves to become vulnerable enough in experiencing the somatic representation of the traumatic experience.
Yeah. Again, people who have had a lot of early trauma, they had the opposite of an experience of safety. So in the therapeutic relationship, in the therapeutic alliance, you have to be able to help the person find some degree of safety. I call it relative safety because there's really no such thing as absolute safety. But as they can be guided to feel some safety, and safety in the relationship, safety in the body, safety in however safety shows up, that's going to make a big, big difference. And the therapist can very significantly help the client find that kind of relative safety with the therapist, but primarily with their own sensations and their own feelings, because you want the person to be able to, of course, the therapy is crucial, but you want the person to be able to find those sensations and feelings on their own outside of the therapeutic relationship.
It sounds to me, if I'm going to try to sum something up here, and you'll either validate or invalidate it. If you're a good therapist, you'll probably validate it, though, right? So it sounds like you're working predominantly with the manifestation, the sensory manifestation of the traumatic experience. So rather than targeting the memory of the experience, the verbal experience, the cognitive experience, taking what the experience, how the experience affected the person physiologically or somatically, and working through that channel.
Yeah, that's the basic idea, the basic principle, to have the person, because when you first connect with those sensations, like I was showing here, it feels like you're contracting. And so it feels worse. But if you are able to establish a quality of relative safety, then you're able to guide the client into the contraction and then guide them into an expansion, the other polarity, and another contraction and another expansion. And what may seem surprising is that it's important not to just feel the expansion or just feel the contraction, but to be able to hold the two together as contraction and expansion, as polarities, at different polarities. When people ask me, well, how do you know that? Well, I say, I would say probably, 50 years of experience, but other people have proposed the same kind of thing in a different form. And I think of the work of Carl Jung and how important his work is in finding polarities and holding the polarities together, not just going with one or away from one, to either run away from a sensation or grab onto a sensation. It's in a way, it's kind of a Buddhistic approach. It really is. Yeah.
How do you prevent flooding? I mean, how do you know when a person starts to go into their somatic experience that won't either trigger a memory or even just trigger the somatic experience to become so intense?
Right. Well, let me tell you a couple of things that I might do. If it seems like they're really activating quickly, if I can just kind of talk them down a little bit, that's what I would do first. But if it looks like it's just going to escalate on its own, what I'll sometimes do is I'll ask the client, I say, is it okay if I take my foot and just touch your foot gently with my foot? So I kick my shoes off. And if they're open to that, I just touch their foot with my foot. And that contact often is enough to calm their nervous system so they can begin to feel these sensations and feelings without being overwhelmed. So in other words, sometimes you don't have a choice. The person they just flood. And then you have to deal with that. As I mentioned, that's one way of doing it, is to really just help the person settle somatically. So when they feel, for example, my foot gently, but firmly, but gently on their foot, I ask them, how does that feel? What does that feel like? And often they'll say, I feel safer in one way or another. And that's, again, about one way of establishing safety. So when the person does have these difficult sensations, they're not flooded by them. They're not overwhelmed with them. So that's one way of doing that.
And I imagine that, of course, you have to take into account whether there was any, traumatic touch before.
Yeah, of course. You absolutely
Asking
have
permission.
to.
So that's, yeah.
You have to have absolute permission. And I always say, is it okay if I gently touch my foot to your foot? And also, if I suspect that there's been some indication that would be contraindicated, I won't do that. Or, well, that's a hard thing, because, again, if the person is starting to flood, you want to be able to do something to restrain them, so there's a decision point, I guess you could say.
A professional judgment.
Yeah, exactly. Again, this is something that I've been doing for 50 years. So I have a pretty good sense of what works and what doesn't work. And, and in our training program, the Somatic Experiencing training program, the first year is really about how to help people feel safe enough in their bodily sensations.
Dr. Levine, many people are asking whether you would consider doing an experiential, role play, or something like that if we have a volunteer. Is that something you would do?
Sure. Yeah.
So if we have a volunteer, please either private chat me, or just give me a thumbs up, or just private chat me, and then we can try to do a role play.
I wouldn't do it a role play, but I might do some exercises to help the person connect with their bodily experience. Yeah.
Okay. So I know we have a couple of questions, but I still have a few more things that we have to cover. So for those of you whose hands are raised, please keep them raised, and let's see if we can get to you. Before this interview, a number of weeks ago, I was sent the gallery to the new book that's coming out.
Oh, right.
Autobiography of trauma. And you talk very openly and vulnerably about the trauma that you went through as a child, that I don't think you ever disclosed until this book. And the book is
right. That's right.
Would you?
That's right. Yeah.
Yeah. Would you be okay or comfortable sharing that experience with our audience and talking about?
I would be.
The somatic.
Yeah. Actually, getting this the thing about not going right into a trauma. Well, I first started to write this book. It wasn't as a book. It was really for my own excavation of really looking back at my whole life experience of my trauma and my healing. And so I had no intention of putting it as a book. But a friend of mine, a colleague and friend of mine, said, I think if you're willing to share this with other people, it could really help them with their own healing, their own trauma. So I decided to go in that direction. So again, the title, An Autobiography of Trauma, A Healing Journey, it's talking about, of course, my healing journey. And like you said, it initially in the book, I talk about a violent rape that I experienced at a time when the mafia was after my family and could have killed my family. It was a very, very difficult time. But rather than going there first, I contacted two bodily experiences, body memories that were much more positive and that could help balance the traumatic memories. And there were two that came to mind. One, I'll mention one. I think I was probably about 4 years old, and my parents quietly went into my bedroom and laid train tracks underneath my bed and then out into the room and then around the room and then back underneath the bed again. And when I woke up, the train was moving around and I was just thrilled would be not strong enough. I mean, I was just beyond excited. I jumped out of bed and I went over to the transformer and I controlled the speed of the train and made the whistle go hoot, hoot, hoot. So from feeling what that excitement was, that feeling cared and loved and safe, that allowed me to go into these deeper emotions, these very difficult, traumatic memories, and to be able to come to peace with them.
Mm.
So I do describe that in the book.
Mm.
And I also try to find a way to have people use that to begin to heal their own wounding. And I wouldn't have published it if I didn't think that it could really help other people. Otherwise, it would just be a gratuitous trauma.
Yeah.
But I felt strongly, and some of my colleagues, my friends, said, "Yes, you can do it. This will do it." And so I got like, oh my God, it's just a wave of relief and a wave of being willing to guide people in their own healing journey.
And can you tell us a little bit? You speak a little bit about this, the somatic experience that you began to develop when walking to school after that assault, and how your body would tense up and whatnot. And how did you use that in the process of your healing?
Right. Yeah. I mean, after that, it was a rape, to keep my father from testifying against the mafia. And even though I didn't have it in a memory, it was not in my memory. But every day when I walked to school, my body would contract, my breathing would accelerate. I would do the typical thing of not stepping on cracks. And then these symptoms started coming up because, again, I didn't have a memory of this. And so I entrusted one of my students to guide me to these disturbing symptoms that I was having. And she guided me and led me through those experiences. And with her help, I was able to heal that very violent wound. And I'm forever grateful. And, and again, it was one of my students who at one time was a student, but now this time was my guide. And so I guess you could say I was glad I developed this program, if for no other reason, so somebody could use it to help me. Right.
Excellent.
Yeah. So anyhow, I talk a lot about different types of traumas that occurred, and and how difficult and different they are to work with. So yeah.
And so it sounds like you actually had memories of the somatic experience, and that's how you worked through until you accessed the memory.
That's right. That's
Wow.
right. Yeah. I mean, I remember climbing. There was a park near my house, and so I would always climb the fence and go down, and there was a running track at the bottom, and I would run and feel the strength and power in my legs. So again, that's a bodily experience of empowerment. So then there was one time when I was climbing over the fence and something seemed amiss, something seemed wrong. And I saw these well, they looked like gang members, they were. And I remember they were wearing hats like Marlon Brando and all of a sudden, as I was going down into the bushes, I was jumped from behind and was thrown down. But fortunately, again, I had the body experience of running powerfully. So I could feel myself beginning to escape from that rape. and being able to again find a place where I could use both memories together.
I see.
The
So
memory
you
of
sort of have
power
resourcing,
in my leg.
resourcing your power and holding
That's
that
right.
together with the experience.
Exactly. So you hold them together. So it's one again of contraction and one of expansion. So to be able to hold them together, it makes all the difference in the world. Because without that, we either dissociate with trauma, which of course doesn't help, or we just get flooded with the trauma.
Wow.
But if we're able to balance a positive experience in our bodies, that's the key, in our bodies, then it can help us have a balanced relationship with the traumatic material.
Well, that's a devastating story, and I'm glad it has somewhat of a relieving ending, and I'm happy for you, and pleased that you were able to resolve that, thankfully.
Yeah. I mean, it's available online right now, so people can order it, pre-order it. But I wouldn't have done it if I didn't get feedback from a number of people that saying, yes, it really did help me. Otherwise, it would have been gratuitous or not even that. But I really do believe, like I said, that trauma is a fact of life, but it doesn't have to be a life sentence if we know how to meet it, not be overwhelmed by it, but meet it, touch into it, move through it, balance it with opposite experiences and opposite bodily experiences and so forth. These are all very important tools that all of us can bring into our awareness, into our being, that can help us in our own healing.
Peter, we have Leva, who was the first one to volunteer. There was a number of volunteers, but would you walk us or her or us together collectively as a group, to see what it's like, give us a little, taste of becoming more bodily sensory aware. Okay.
Sure, I can do that. Now, who am I working with?
It's me.
Oh, Leva.
You should see her on your screen.
So
Thank
I'm
you
gonna,
so much.
yeah, you're welcome. I'm going to suggest an exercise for you and I to do together, but also for anybody else who wants to do it. Who is here, and the other 100 people who are in the group here. So the idea here is to take an easy full breath, and on the exhalation, make the sound, a gentle sound, a voo sound coming from the belly. And then just letting the sound and the breath all the way out.
Okay.
And just wait for the breath, a new breath to come in on its own, filling belly and chest, and then repeating it one more time. So I'll demonstrate it, and you can do it if you want with me. If it doesn't feel like it's right, or feels like it might be too much, you can just listen to me, watch me doing it. So I take an easy full breath. When I'm vibrating, that's it, right in the belly. Voo. Good, Leva. And then let the breath come in on its own, filling belly and chest, and then again. Good. And just take a few moments just to notice sensations, feelings, thoughts. And what are you noticing, Leva?
Oh, there's a part of me that's wonderfully surprised, because when you first told me what I should be doing, there was a fear that the breath wouldn't come. And I waited a while for it to come, and then it did come. And it's like, okay, my body is, I guess, taking care of me.
Your body knows what to do.
Yeah.
I mean, I can give you an explanation for this.
Sure.
But the main point is the proof of the pudding is in the eating. That it feels easier. often people will experience sensations and a vibration of tingling, sometimes warmth, vibration. But it's now sometimes it can bring up difficult material, but again, you can use that as a platform to work with what traumatic sensations might come up. But generally, if you just do it again a couple of times and gently allow the full breath and the exhalation with the sound, that the person feels more settled afterwards, more calm, more regulated, more connected to their bodies. Yeah. So again, yeah, go ahead.
Ooh.
Ooh. Ooh. Let the breath come in, filling belly, chest. Ooh. Good. And what are you noticing, Leva?
There's almost a part of me that's scared to, like, coming back to that breath. There's a part of me that's scared to, like, let go and just let it come in.
Oh, wow. But it sounds like you were trusting it enough to do it.
Yeah.
Oh, that's great. Yeah, I want to just reinforce that. I mean, that's wonderful that you were able to, even though it was difficult and felt like maybe also there was a difficulty in breathing, that actually it actually allowed more breath to come.
Yeah. And then the next breath is a lot fuller and life.
Exactly.
Yeah.
Good. Oh, thank you.
Thank you so
so
much.
Again, these are the kind of very simple things you can do to help the person come to a positive experience. It's sort of what I was describing when I woke up to the train going around in my bedroom. And that I was really so deeply moved and touched that it allowed me to go to the difficult sensations in a way that was not overwhelming, that was not overly frightening. And that's, again, some of the base, and that's, I think, one of the reasons why somatic experiencing is such an important approach, because it really works not just with the trauma, but with a balancing between the trauma and the healing, the contraction and the expansion. And so to be able to have access to both can make all the difference in the world. Again, it was a very simple thing, and you did it. Would you like to try one more piece?
I would love to.
And this is a little bit more of a challenge. And so again, if it doesn't feel right, you can just observe me and notice how it feels to you when I'm doing it. But I'm going to start with the same thing, and then I'm going to bring in my jaw. It's like a gentle growling sound. And so I'm going to open my jaw until I feel my jaw tensing, and then let my jaw close a little bit, and then let the jaw open a little bit more this time with the growl. So here, I'll demonstrate it, and then we can do it together if you want, and anyone else can do it if they want. So growl, 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 growl.
Okay.
Give it a try. Wow. Wow. And just sense your body. Just sense, just feel, enjoy.
Yeah, it's like it's two opposite feelings that I'm experiencing.
Okay.
it's both like I guess joy and delight and comfort in being able to do this with you, as well as like a big part of me is very tense.
But enjoyment, joy, and tension. So again, contraction and expansion. Can you be with both? Do you be equally, to not try to push one away or try to grab onto the other, but just to experience them together? And again, that's one of the keys in somatic experiencing, is to not fight against it nor grab onto it, but just allow it to emerge within our felt experience.
I think that the challenging part of that is that the part of me that's tense pushes away, or like it feels like this part of me is trying to push away the part of me that's calm, and the part of me that's calm, like, I want to be here, you know.
Right. But again, to be able to hold those two together with curiosity, that's another key in working with people who have had trauma. And it may sound like it's unreasonable, but it's not. To really help the person be curious about what they're experiencing, as you were curious about feeling both joy and openness, but also something else, which is maybe the opposite experience of that. So can you be curious about that, how that is for you in this moment right now?
It's really hard to hold awareness of both at the same time.
It is. It is. It is. And I appreciate that you're attempting to do that. Well, you are doing that. And I'm glad. I'm glad that you felt vulnerable enough to share that with me, with us, with all of us. So thank you.
Yes, and thank you, Liba, for that.
Thank you so much. I appreciate it.
Gladly.
Okay.
Yeah.
I want to ask you another question, and then we'll see if we have time for questions. There are people who have, I guess, described to me that they're experiencing, this is in particular in my community, a relative of mine who's not a practitioner described this to me, and a client or two, because of some of the tension that people are experiencing with what's going on in Israel and their loved ones and relatives. We all have relatives, and we all know somebody. So people are experiencing somatic symptoms. For instance, a number of people told me that they're having pain in their teeth. Because of the tension that they're experiencing when they sleep at night and whatnot.
Right. They're clenching.
Yeah, they're clenching, right. Are there things that can be done using somatic experiencing that are not based necessarily on specific trauma, but on a present anxiety?
Well, we just did that together with Liba, because when she was working with her jaw, that's releasing that tension that's in the jaw. And you don't have to know the trauma. You can release the jaw. And, and we're all experiencing so much grief but rather than being stuck with the fear, we can move through the fear enough so that we're not grinding our teeth at night, we're not gripping our jaw. So again, to do things to release some of the tension. And if other material comes up, traumatically based material comes up, to just touch into it. But also especially to help us, one of the things I've been working with therapists in Israel is how to work with fear, because people are locked in fear. And what I said, or what I suggested, is that we have to help the person deconstruct fear. So fear is made up of basically three components: bodily sensations like wrenching in the gut and so forth. Secondly, with thoughts. And thirdly, with images that might be coming up. Now, when we are able to uncouple the sensations and the thoughts and the images, the sensations will tend to move through on their own. And so that's a way of deconstructing the fear and reducing the effect that the fear has on us, because these are fearful, fearful times. But we want to at least not be pulled down by our fear, that we at least have some range of movement, range of motion, so that we're not locked in fear, so that we can move just into fear enough to become aware of the sensations, the feelings, the sensations, the images, and the thoughts, and then to be able to move through the sensations, and then to be curious about the thoughts. Sometimes when people have thoughts that come up, and often they're negative thoughts. So maybe this person comes up and says, well, I have this, they say, I know this is not going to last, because they're feeling better. And so they say, well, I know this isn't going to really last. So what I suggest they do is just preface that thought with the sentence, I have the thought that this isn't going to last. So what's the thing here? Well, by identifying it as a thought, I have the thought that this isn't going to last, or it's not going to, I'm afraid what else might come up. I have the person say that I preface it, I have the thought that way they get, okay, it's a thought, because we confuse thoughts with reality. Mm-hmm. And thoughts are not reality. They're just thoughts, like other sensations and feelings and thoughts. And when we can identify them, then they'll move along, just along with our sensations and feelings, because they're nothing special. They're just thoughts. So I have the thought that. So again, it's a very simple practice. I think, again, it fits in with some of the Buddhist practices. But I think many religions have that as as also a baseline. So, oh my gosh. So I'm going to have to kind of wind down here. And I imagine you are also pretty 7, 8, 9.
Well, we have people are raising their hands, wishing they can ask questions. I don't know if you have the time for that.
I could take a couple of questions, but yeah.
You tell me when it's too much, okay? We'll be mindful of that. Greg, do you want to ask something? Go ahead.
Sure, thank you.
Let's try to keep them brief. So,
Peter, thank you so much. I've done quite a bit of work with Catalina Ureta over the years.
Sure.
And she adores you, and everything is Peter this, Peter that. This is what Peter says. One of the, in addition to my work with her, that's been profound for me as a client. I saw an interview. It was either an interview or in one of your books describing your experience with the Hopi, and also in the Amazon. There was one specific story of the woman who had twins that were lost.
Oh, yes.
And your experience coming through that in terms of healing taking place in community. And I wanted to extend a thank you to you, because that sharing of that story was a catalyst for a profound healing for me personally.
Wow.
Where I had done 20 plus years at the time of very individual focused trauma work in terms of my own childhood trauma.
Yeah.
But your sharing prompted me to reimagine my healing process, not as individual work, but as a family gathering around the dinner table.
Yes.
I got to share with my father. I imagined my father and my mother holding a space for me and my brothers to each take a turn to share about our day and our experience. And so just heartfelt gratitude for all of your work and your inspiration.
Oh, thank you. Oh, that's beautiful. Thank you. Yeah, I mean, that's one of the chapters in my autobiography. I think it's something like many cultures, one race, the human race. And I look at different cultures and how they've dealt with trauma and loss and grief, because cultures have done this since the beginning of time. Trauma is not something new. I mean, the Greeks dealt with it, the Egyptians dealt with it. It goes back, ad infinitum, and to so-called primitive people, so-called, who may actually have more in common with really what it takes for healing. So yeah. So that, I think that would be a useful chapter to read. And I had the opportunity to spend some time with an indigenous tribe in Brazil called the Kranaki people. And one of the women there had a birth that was problematic because she had it was twins, and they had to have a cesarean, and they brought her to the hospital. And when she had the cesarean, both of the twins were not alive, and so she was in profound grief. And they wanted to do shock treatment, and so the members of the tribe went and they climbed the ladder and rescued her from her room and brought her back to the tribe. And they have a beautiful ritual of movement and dance and rhythm. And she would just be there. She didn't join in. She was still too shut down in her grief. But after several days, all of a sudden, she got in with the others, and then they all started to cry, and she started to cry, and then she had moved through her grief and was able to heal with community. And community is absolutely important. And when you're saying we do just therapy one-to-one with a therapist, that's really only one it's only one way of dealing with trauma. It really is also so important that we deal with it in community. And again, that chapter is really about dealing with trauma in community.
Thank you.
Pepka.
Oh, wow. I have a lot of questions. Wait, I can't see because I'm seeing Greg. Okay.
I'm going to take off Greg, but just
Okay.
we have to be brief.
Okay. I have a lot of questions, but one that's coming up for me is in knowing IFS, which I'm sure you're familiar with, how important it is to know, like with a bodily sense, that you're talking about what part it's coming from and how that overlaps with SE.
I'm sorry, say that again. I missed the first part.
With IFS, which I don't have to explain.
Dick Schwartz's work, yeah.
How important is it in the felt sense to know what part it's coming from?
It's very important. It's very important. It's very useful. The thing about somatic experiencing is it's not a therapy per se, but what it does is it helps people do what they do better. So initially, when I started teaching it in the 70s, a number of people said this should only be taught to psychologists and psychiatrists. And I respectfully disagreed. I think this is something that really is important for all kinds of people who are involved with the healing arts. And again, whatever, even if it's cognitive behavior therapy, if you're also able to reference some of these things in the body, that can make a very big difference. So again, my motto, it's not just what you do, but how you do what you do. That's reinforced with somatic experiencing.
So can you just be more specific? Like you said, it's very important to know what part it's coming from. So, but you don't bring that into your SE technique. So obviously you don't think it's so important. I'm not sure.
Well, usually if it's important, it will come up. In other words, if you create, again, enough safety, and then something starts to emerge, then you can choose, or the client can choose to work with that. but I'm not looking for a traumatic memory. I think that's maybe the simplest way to put it. But if it emerges, it's the choice point of how to work with it.
Mm-hmm. Okay.
Okay.
Thank you, and thank you so much for sharing with
Sure.
us.
Yeah. Yeah. Well, yeah. Yeah.
Okay, Tova, are you still there? Well, we were going to take one more question if Dr. Levine is okay with that, but now I see your hand disappear. If you're there, you can unmute. Tova? No? Okay. Well, Peter, I really want to thank you for agreeing to do this for us and share and open our minds and hearts, especially like, we mentioned earlier, it's a really tough, difficult time for many of us.
Yes. Oh, yeah.
All, and we can all use this support.
Yeah.
Feeling supported by you in
Yeah.
agreeing to do this, and
Yeah.
some of
You
these.
know, I don't know if you know Gina Ross.
Sure, we had her on. Sure.
Okay, good, because she's done a lot of training to the therapy, the Jewish therapeutic community in New York, and of course she's involved very much with with what's going on in Israel.
Yes.
But she's a really good resource to have.
Excellent. Well,
Okay.
we'll bear that in mind. She was actually on this show once or
Oh,
twice.
good. Yep.
I appreciate that resource. Okay, well, thank you very much.
Okay. Contraction expansion.
Contraction expansion. Let's all keep that in mind. For
Right.
anybody who wants to stay on and continue discussing somatic experiencing and asking some questions about Dr. Levine's work, you could please stay on after the show is over. Dr. Levine, thank you very much again, and have a wonderful evening. Good night, and we're going to stop the recording now. And
okay, igualmente.
be well.
Bye-bye.
Bye-bye.